Hello, everyone. I would like to introduce our doctor. Today we have Dr. Wyncel Chan. Is that right?
Yeah, you got it.
Thank you. She's a recent graduate from Hurley in Flint, Michigan. Originally from Canada, is an internal medicine graduate from the Caribbean Medical School, known as Saba University. Starting general pediatrics in September in Indiana. Doctor.
Awesome. Hello. All right. So hi everybody. I see a few faces. Feel free to chime in if you guys have any questions right away. Thank you for the introduction and thanks for having me tonight. Super excited to talk to you all. So as mentioned, my name is Wyncel Chan. I'm a general pediatrician starting in September. I recently graduated in Flint, Michigan, and my pediatric residency finished this June. I'm originally from Vancouver, Canada. That's the West Coast, if you're not familiar with Canada. Do we have any Canadians by any chance, or is it all American?
It's all Americans.
All
Yeah,
Americans, okay.
I believe so.
Okay, just need to know my audience if I need to talk about the transition and stuff. Okay, and so I'm from Vancouver, Canada. I went to Saba University, which is a little tiny Caribbean island, which makes me an international medical graduate. So this is an opportunity, I think, for me to share that kind of pathway if for some reason that is something you might need to do later on, to just give you a general introduction in that. And then my other goal was to really kind of introduce you to what residency looks like and kind of the pathway to that. So that's my brief overview. And then, so pediatric residency is 3 years in the United States. So I finished in 2017 medical school, and I did my 3-year residency again in Flint. So other residencies, I'm not sure if you guys are super familiar, but it can range from 3 years up to surgeries like 7 years, and then you do fellowship after that, which is more specialized training. So I just did the general pediatrics at this point. So from there, residency takes up 3 years of your life, and you're kind of living in the hospital, as many of you are probably familiar from TV shows and stuff. You have your calls and 24-hour coverages, and you go through what's called different blocks. So each block is a 30-day month block, and it goes through all the big specialties that a pediatrician needs to know. So you do things like the NICU, which is the neonatal ICU, the PICU, which is your ICU for general pediatric ages, and then you do your floors, and then you have clinic, and then you can do subspecialties and emergency. So from there, you rotate every month and you're changing every month, doing different coverages. And then when you're on electives, or what's called subspecialty, which is kind of like your more clinic, when you're in different specialties like cardiology and endocrinology and all these different things, you might need to cover on the weekends as well. So it's a very busy 3 years of your life. And if you guys have specific questions to that, you can either ask them now or ask them later, but I thought I'd give you some insight on that. And then from there, you can decide after you graduate if you're going to take a attending position right off the bat with no further training, meaning you're not going into fellowship. A fellowship is after you finish residency and you choose something that you want to specialize in. And that can be, again, cardiology, endocrinology, sports medicine, pulmonology, ICU, neonatology, et cetera, et cetera. So I'm a general pediatrician. So basically I'll see kids in clinic, and that is kind of what you guys are probably familiar with having pediatricians in your life, where they see you, they give you your vaccines, they make sure that you're developing well through basically infancy up until it depends what the clinic takes, but up to usually the age of 21 is when we finally pass them off to adult medicine. And then a general day for a pediatrician is usually a clinic day. So you either start like 9 to 5 or some kind of equivalent of that. And then there's coverages as well if you want that to be in your life. So I chose pediatrics because I was a pediatric patient myself. As a 13-year-old, I was diagnosed with lupus. So yes, you can have a chronic illness and go through medical school. You might be super tired and there might be some other stuff along the way, but I know I get a lot of questions on my kind of social media platform because I'm a huge advocate for lupus and stuff that you know, no matter what's thrown in your lifestyle, your dreams still can come true as long as you try to kind of push through. So that's another piece of why I chose to be in pediatrics. And then I get a lot of questions about like why pediatrics, as well as kind of what's the other specialties like and all that. And then that's really great that you guys are kind of highlighting a bunch of different specialties on your program and stuff. But what I was told as a medical student from the get-go that still resonates with me now, and I try to pass on to anybody thinking about where their life is headed in medicine, is imagine what you can do on a Friday night, and if you can do anything else but that, then maybe that's not the specialty for you. And then that's what somebody told me about surgery. If you can picture yourself anywhere but the OR on a late Friday night, even if it's eating somewhere, you might not want to do surgery because it calls for those kind of that kind of dedication. So do you guys know about all the different exams and stuff along medical life? Do you guys want to know about that?
Yes,
Okay.
please.
Okay, so so there's a lot of exams to become a doctor, which you guys are probably kind of just dabbling into the idea of. One of the reasons why I really wanted to do this is because when I was first deciding medicine as a teenager, I had no idea the extent of what that kind of meant. So kudos to all of you for kind of taking this initiative and kind of having an idea from the beginning of what it entails to kind of finish this journey. So basically you start with your pre-med stuff. Obviously in high school, if you're interested in anything, you get into college, and then in college is kind of when you start thinking about your pre-med requisites. So this is pretty across the board, your bio, your organic chemistry, your chemistry, and all the different kind of subspecialty electives along the way that they kind of throw in there so that you're a full human before you come into med school. Full human, quote unquote, meaning you can do linguistics and humanics, all the different kind of stuff when you're in undergrad, but you have to make sure that you're checking off those major classes. So when you're applying to med school, they can see that on your transcript. Your major doesn't really play too much of a big factor, because as long as you're hitting those prerequisites, I've had, you know, friends along the way who've been done majors in English and I don't know, literature and XYZ, as long as they're doing those prerequisites. That's all that matters. And then from there, you're going to take your MCAT. And during your MCAT is when you kind of like get that general score. When I took it, which sounds like I'm very, very old, it was a totally different scoring system than what you guys are probably going to face when and if you guys take that route. So I can't really give you too much insight on that, except that it is like a whole day test. And then from there, you submit your MCAT scores to the different med schools that you want. Being that I'm from Canada, I can't give you, again, too much insight on the journey of getting into a medical school in the US. But basically, if you're willing to move and you're willing to try a different route of getting there. You don't need to stick to MD. There's DOs as well, which is a great opportunity for you guys in the States. We didn't have that so much in Canada when I was growing up, and I wasn't familiar with that until I got to know DOs in medical school and residency. And then once you're in medical school, you do 2 years typically of your basic sciences. So this is when you learn about your anatomy, your physiology, and all those big kind of gross subjects. And then you will take what's called step 1. Step 1 is, I'm assuming you'll get familiar along the way, but again, I didn't know about step 1 until I got into med school, and this is your big test. They recently changed it to a pass-fail, where it used to be a 3-digit number, and this just changed this this year, and this was pre-COVID decision as well. It was a decision that they had made, hoping to allow medical students to lessen their burden of the stress that comes with getting that test done, as well as obtaining a 3-digit score. So it's very hard to say the implications of what that test score is going to mean for matching in the future. And matching is the big process that happens when you try to get into a residency program. It's called the match. That score used to be a 3-digit score, is now a pass-fail. Step 1 is about an 8 to 9 hour exam. I can't remember exactly, but it's again a whole day. And then that score usually leads you into your 3rd and 4th year of medical school. In your 3rd and 4th year of medical school, you'll do rotations in every little specialty. So family medicine, pediatrics, internal medicine, surgery, OBGYN, psychology, and I'm missing a couple, I'm sure. And then in your 4th year is when you get to pick really like kind of nitty gritty specialties. So if you really want to do emergency, you can go into try it an emergency elective. If you're really into pediatrics, you can try and do some further pediatric rotations. And then along that last 2 years, you're going to take what's called step 2, which is in 2 parts. There's step 2 CK, which is your clinical knowledge, which is very similar to step 1. It's again a 9-hour-ish exam. And then you also do what's called the clinical skills, which is 12 simulated patients who are really great actors actually, and they get given a synopsis of what they're supposed to act for you, and from there you have to do your physical exam, and then you have a timer and you have to come out and type out your differentials of what you think is going on with them and how you would proceed with their management. So that's step 2, part A and B. And then you will use that score and those pass or fails to do your application for residency. Residency match is always March. So you usually start it in the fall of the year prior to when you want to start your residency and finishing medical school. And then again, you will choose your given specialty that you want to take residency in. Again, it ranges from 3 to 7 years, depending on what you're doing and where you're going. And then from there, you will also finish up with step 3, which you will take in your residency program, which is the final big test as a medical student or resident. And that is a lot of tests. And if you guys have any questions about that, I know that was a handful of stuff, please let me know. I can't see anybody anymore, so I don't know if you guys are all there.
Yes, we're all here. Yeah, just
Okay.
making sure. So everyone, we would like to open it up to questions now. So my apologies, Dr. Chan. So Dr. Chan could take it away and elaborate even more. So if you guys can write your questions in chat, that would be appreciated.
I see. What happens if a medical student doesn't match. Okay, so this does happen. It is a very competitive thing because it is once a year. So when a medical student doesn't match, it actually goes automatically to that week is called a SOAP. I don't remember what that acronym stands for. I think it's supplementary something something. And basically you have to reapply to all the open spots across the country. And it's another kind of set of days where you'll do quick interviews. Usually it's like by Zoom and stuff, or a phone call interview, just to give that new program that you've recently applied to an opportunity to talk to you. And then if that doesn't work out for you by the end of the week, so match day is on a Monday where you find out if you matched, and the Friday is where you find out where exactly you matched. If you don't find out by that Friday with either the regular match or the SOAP, then unfortunately you'll have to wait a whole year until you can apply again. I hope that answers your question. Let me know if that doesn't. Do you do surgery as a general pediatrician? No, I do not. I can choose to do some circumcisions, and I can do some basic suturing and stuff like that. But I do not do general surgery, nor do I really want to, truthfully. As a fellow Canadian, I found that information for you. Okay. Yeah, so being a Canadian, we have limited amount of medical schools. So truthfully, it's very province-based. There's only 10 medical schools really. Ontario might have 2, and then Quebec only has the 1, and you have to be French affluent to go there. So I really didn't look into Canadian medical schools, truthfully. I directly looked into the Caribbean route and everything, because I knew how competitive it was. So I really looked at a lot of the US medical education stuff like you're stating. And I tried to talk to some of my university professors who were either in like my specialty, which was health science as a major, and seeing if they had any advice from that standpoint. But again, a lot of them don't, because unless you're going into the medical field, you don't dive deep into all the needs, like the resources like that. The most challenging parts of medical school. It's a lot of information constantly, and the comparison factor is a huge thing. I think as a pre-med or high school student or throughout your medical career, you're going to feel a lot of competition with other people, and it doesn't need to be that way. I think it's changing in a lot of ways where people such as yourselves are willing to support one another and get opportunities to share information. However, medical school and just kind of that mentality breeds a lot of competitive type A personalities. So that's a difficult challenge, is kind of navigating your insecurities as well as your strengths, and knowing that your passion is a huge factor in what makes or breaks a medical student. But again, I also went to a medical school that was on a really tiny Caribbean island. I was away from home. I've been away from home for the last 10 plus years now. So again, I would change nothing. I really appreciated my journey, but it's difficult to be away from home if that's what you choose. And just the long hours and saying no to parties and saying no to family events and all that kind of stuff it takes a lot of determination and dedication. How did you know medicine was right for you? If you can picture yourself again doing anything else, I can't picture my life without medicine. Every time I go into the hospital, even if I'm really, really tired, I get excited after a long day. If there's a really cool case, or you get a hug from a patient, it's life-changing, and you'll never want anything else if it's right for you. How many years is the entire process right out of high school until you can practice? So it depends if you're considering residency opportunity to practice, because technically you're already called a doctor, but you are under your attendings. But to be an attending myself, it has taken 5 years of undergrad, 5 years of med school, 13 to 15 years since high school. One interesting case during your time as a pediatrician. Unfortunately, so I mean, this is a big piece of something I didn't know. It's not necessarily interesting, but it is super important to understand if you're thinking about pediatrics, is that you're gonna see a lot of trauma, neglect, like child protective services cases, and you'll be alarmed at how many of those kind of things go under the radar. So that is something I did not think about so much when I was like matching and going through medical school. But when you see that kind of unfortunately frequently, or it has to process in your mind frequently as a differential, that is definitely something that's interesting to me, because again, it's something that we all should be looking out for and protecting our kids from. Other interesting cases, I mean, there's just so many different varieties. If I think of one along the way, I'm gonna come back to you. How long did you study for each test? So each test, again, is kind of built into your curriculum. So your first 2 years of medical school leading up to step one truly give you the basis of, so you're studying every day basically for 2 years preparing for that test. But to actually take that test, I probably took 6 months of rigorous studying. I also had a little bit of a setback in my medical career. On the island, you're supposed to take an exit exam to move on to your 3rd and 4th year of medical school. So I actually didn't pass that exit exam twice, and I had to pass it on the 3rd time. So that kind of prolonged my journey to take step one, which again, I talk about freely because in medicine, a lot of people don't highlight their failures. You only see their successes. And it's super important, especially as, you know, people going into it at a fresh standpoint, to understand that all those people that you're looking up to or taking advice from didn't just become doctors all of a sudden. They all started from somewhere. They all had shortcomings and failures along the way. And so that was what led my first step one test to be a little bit delayed. But from there on, I mean, you're just studying constantly throughout medical school and throughout everything. So really it should only take you a month or two to really hone in on the question bank and then take the test. One of the biggest advice that I can also give you is never to really postpone your test unless there is some really, really big reason why. I've seen a lot of people postpone because they just don't feel ready. And then the more and more time that you pass repeatedly doing the practice questions and all that kind of stuff, it actually deters you from kind of hitting your peak test score. So just keep that in mind when you guys are doing them in the future. So actually, I'm not a general pediatrician just yet. The question was, what's my experience? I'm just finished residency in June, and I've actually just been taking some time off. I'm moving next Tuesday down to Indiana. I'm currently in Michigan, and I'll be starting my position in September. I had the opportunity to do that while some of my visa stuff is getting sorted out. So I've been studying for my board exam. There is a board exam after you finish residency. I did not talk about that, to become a board certified whatever. So there's board certifications for family med, surgery, and mine in pediatrics will be in October. great question. So why did I choose general pediatrics versus a specialist? So when I first started residency, I actually was very interested in rheumatology. Again, as a previous patient from rheumatology, I was super interested in that. I went to a conference, like a nationwide conference in San Diego, and I was bound to go do a rotation at a bigger hospital in that. But after I did that conference and just seeing how niched it was, I just couldn't see myself doing rheumatology for the rest of my life and just focusing on that. I was still getting so much experience and kind of excitement from clinic and from the ED and from everywhere else that I just didn't think rheumatology would be enough for me. So I took a step back and decided not to do my away elective at a different hospital. And then along the way, I also got really interested in sports medicine. Sports medicine is a 1-year fellowship, and I thought it would allow me to go back to Canada quicker. But due to sports medicine not being, counted for in Canada, I decided not to do it. Also, after my elective in sports medicine, I went to Lurie Children's in Chicago, and I really liked the rotation. I got some great experience, but again, I just felt like it felt really repetitive, and I couldn't see myself doing that every day as well. So then I finally decided that as a general pediatrician, I'm going to see a lot of different things every day. I'll see the bread and butter pediatrics, but I'll also get to see a little bit of everything, which I think will just suit me better. So that is that answer. I hope that helps. Have you met and treated some COVID patients? So I'm not sure if you guys are aware, but COVID doesn't hit kids as much, or it's not hitting them as prevalent as our adult patients. So we did have a lot of rule out patients when I was finishing up in March on the floors. We had one really sick girl who was in the ICU, but after weeks of tender love and care and treatment, she was able to walk out of there. So that was a success story. And then after that month, I was no longer in the hospital. That was actually my last rotation ever in the hospital. So I didn't really get to see any more of that. And I'm not keeping up with the numbers right now at the hospital. But I think other major hospitals have been seeing a little bit more as well. How did you know peds was the move? Yeah, pediatrics is a very kind of specific person. You either like kids and can deal with them. I don't know how to explain it besides you'll just kind of know. You'll also have to deal a lot with the parents. So sometimes people really don't like that aspect of pediatrics because you're getting most of your information from like the middleman, which is the mom or dad or caretaker. So that's a huge thing to think about when you're doing your rotations, is how you're kind of navigating who you're talking to and how you're enjoying that. But I love kids and my interaction with kids, and I can't explain it besides that. I honestly don't remember my NCAT score because it's not used anymore. I haven't had to quote it or need it for any paperwork after I got into medical school. And then again, because the MCAT changed, I don't even think my score, I think it was a 2-digit score, a 3-digit score. It's no longer that anymore. And I had a whole English like essay writing section, which was taken out a couple years after that, and they revamped the entire thing. So I don't think knowing my MCAT score is going to help you in any way of gauging. I'm sorry. And my overall experience in a medical school in the Caribbean. So my caveat with choosing a Caribbean or IMG school is that they give you the opportunity to get your dreams done. So again, going back to how competitive Canada was, I just knew I had to go elsewhere. I had seen a lot of my friends in university apply and get rejected multiple times from their home state or home province medical school. And these were like 4.0 GPA, extracurricular, XYZ applicants. And so knowing that I wasn't exactly a 4.0, I had a lot of extracurriculars and all that, I knew I had to maybe move to get that done. So my overall experience with the Caribbean is that it gave and opened that door for me. It is a long journey. The States is becoming a lot more IMG friendly. Again, IMG stands for International Medical Graduate. And as Americans, they're even, so it goes into tiers. It's IMG American, IMG Canadian, IMG from any other country. So you guys are kind of the top if you were to go that direction of who they're looking at, because you will not need a visa when you go into matching. But overall, the curriculum prepared me. They prepared me for the tests. I had competitive scores for that. And then it got me into matching my first go. Again, that doesn't happen for everybody, but I think it prepared me very well. You just have to be willing to move and do long distance friendships and relationships and family life and all that kind of stuff. What motivated you during medical school and your residency? What do you mean by motivated? Just in general? I think I was just motivated by the fact that I love medicine. I love being with patients, and when the days get long, you just have to remind yourself that you're ultimately helping somebody's life, either in that moment or in the long run. I'm super passionate about preventative medicine, and that's why I like pediatrics so much as well, is because you get to kind of shape their lives and how they may be as adults, and prevent long-term diseases and chronic illnesses at an early age, and being that person to help set up that foundation is something I remind myself all the time when I'm with patients after a long day. How was your experience being away from family for so long? It is still ongoing. Some days are easier than others. Thankfully, FaceTime and Zoom and all this kind of stuff keeps everybody connected. That was actually just starting up when I started medical school. So I used to have to use the thing called a magic jack and call in and dial up and all this kind of stuff. I sound ancient. But it's hard. But again, I wouldn't trade it for anything. It grew me into the person I am today. I think it was a huge factor in a lot of my interviews going into residency, was using all those different experiences away from home and living in the Caribbean and rotating all around the States. So everything is an opportunity. It just depends on how you see it. Tips you can personally give for interviews. Be yourself. Don't overthink what you think they want to hear. Standing out in your own character and your own right goes beyond anything, your paper and all that kind of stuff. Again, most applications have a score, have the extracurriculars, have a good university, XYZ. So you have to really stand out by your own right and who you are and what you can offer to either the medical school or the residency program. They want to see that you're a team player, and that you're willing to adapt. So those are some key things for interviews. What are my favorite and least favorite aspects of pediatrics? My least favorite is teens, and just because it's so difficult to talk to teenagers when they're in the clinic with you. And I know you guys are all kind of that age right now, so nothing against you guys. But it's very difficult when you're trying to treat them as an adult, then they're still not quite there yet. And my favorite part of it is seeing babies, seeing them flourish and grow, and getting to kind of know them in that first year of life is beautiful. Was it more competitive to get into a US residency? Yes, I mean, as a Caribbean med student, you're, again, lower on the totem pole of choices. You have to be very selective in the programs you're applying to. That's a whole other discussion in and on itself. If you guys are interested in that specifically, please feel free to reach out to me personally. My Instagram will share at the end and everything too, if you guys want. But I answer a lot of that kind of stuff once you guys gonna get there. Do you think pediatrics require strong mental health? Because some physicians say that losing pediatric patients is harder on a physician. Yes and no. Losing a patient, period, is always difficult. Talking to my colleagues who are in internal medicine and family medicine, a lot of the times they kind of have an idea that it's coming more so than a pediatric patient, due to chronic illnesses and comorbidities and stuff like that. So they get a little bit of a longer time to prepare for that. And it also happens more frequently, just due to age. So it's not that it's necessarily harder, but you just tend to get used to it, for lack of better words. It is very difficult to lose a pediatric patient, but because it doesn't happen that often, because it doesn't happen so often, you'll just remember it a lot, and you'll learn from it. Did you do to get into medical school? I volunteered a whole lot as a high school student. I have so many. I did, what did I do? I volunteered at soup kitchens, at hospital as a transitional care unit. I helped patients kind of do their physical therapy. I also had a job, a part-time job. I did fundraisers. I was a peer mentor. There was a lot of different things. But again, when you're choosing your extracurriculars, they'll tend to see that you're not very interested in them. You're kind of just doing them for your resume. So just don't do it just because you need it on your extracurricular. I would say make it fun for yourself and make it worthwhile. Do it because it's something that interests you and you actually enjoy for the afternoon or the period of time that you're doing it. What are some things you did to manage your mental health? And what is work-life balance? Yes, so mental health obviously is a huge component of medicine and getting through it. I work out a lot. That is something that I fell in love with around my third year of medical school. I was always into sports and everything in high school, but in my first 2 years of medical school, I kind of fell off just because of the workload. And I realized that I was becoming unhealthy, body and mind. And so I really tried to incorporate that a lot more. So I do that a lot. I work out even throughout residency. I've been working out 5 to 6 days a week. I do meditation, affirmations, mantras. I read spiritual books and self-help books. I love it all. Again, if you guys want more detail about that, my Instagram is all about that, truthfully. And it's literally quoted med life balance as my little tag. So I'm very passionate about it. I was also the wellness chief for my residency program this last year. So I'd really tried to teach the other residents some of those life skills as well, which I find I think is very important. I also started an exercise prescription program at the clinic that I was working at in residency. So I took an extra step and tried to empower the kids to also see that exercise was a tool for them in life. So very, very passionate about wellness and exercise, and that is what kept me going in terms of my mental health. Thoughts on BS/M? What do you mean by BS? Sorry, if you can specify, and I'll come back to you. What was your experience like in medical school while coping with lupus? So I was diagnosed with lupus at 13. So it was quite in control throughout medical school. I think keeping a healthy lifestyle was a huge component of that as well. I've been on medication since I was a young person as well. So just making sure I was keeping up with that. Lupus, if you guys know, it hits everybody very differently. So mine really hits my joints and never hit my organs up until last year. I did get some intestinal issues, which has since resolved. So it really varied, but overall my experience in medical school with lupus was minimal, except for just being staying up on it and everything and being cognizant about it. No, I do not have any regrets. I think everything happens for a reason. You might not understand it in that moment, but it all leads up to making sense later. So I have no regrets about my journey. Sketchy medical or Anki methods. I am not sure what those are. I may have done them. I don't know what they are. If you're talking about sketching and everything about diagrams, I wasn't huge on that. I was a highlighter. I printed my slides and wrote all over them. I will be living in Bloomington, which is the where Indiana University is, and I will be working in Bedford, Indiana, which is south of that. Did your major help you in med school? So my major was in health science. I think it just helped me in the sense that a lot of the things that led up to my major was also part of my prerequisite as a medical student. So it helped me in terms of that. There's a lot of epidemiology and statistics. So that helped me when I have to read journals and all that kind of stuff in medical school and residency. So I would say 60%. But the rest of the stuff you don't really touch anymore. I never had to do organic chemistry or anything like that after university. If a med student doesn't match and has to wait a year, no, you cannot retake your exams unless you fail. So your step 1 score and step 2 scores are yours forever. Again, with the new rule about step 1 being a pass or fail, I mean, there's going to be people that need to retake that, but you can't redo them to get a better score. I went to Simon Fraser University in British Columbia. What is the crazy experience you had in residency? So I was a resident in the pediatric ICU. As a 2nd and 3rd year resident, you're alone on nights. Your attending is always around for phone calls, and it will come in if needed. But basically, you are running the ICU by yourself with the nurses. So in one night, I had, I think, 8 admissions, which means I did the history, taking in the notes, and I admitted the patient and managed them. And then I had like one transfer. And then unfortunately, at the end of the night, I also had a gunshot victim. So I was helping manage that as well. So that was just a crazy experience because everything came together and I was running the whole floor that evening with a lot of acute patients. I will be only doing outpatient work right now. I do have the opportunity to do some coverage in the hospital, which is called inpatient work. I was offered this outpatient position the way it is, and I just thought this would be a great starting point for my post-residency focus. I really want to get my handle on the outpatient life prior to starting doing both. Management in outpatient is different from inpatient, so I wanted to hone in on the skill of outpatient before I dabbled into the inpatient world. What was your answer to interviews? To why do you want to be a doctor? I don't remember it exactly, but I'm sure it is still the same answer now, more or less. It was to truly help people. And I always went back to my experience as a pediatric patient or as a patient in general, which I'm sure you guys have once been in your life. But you remember the good doctors and you remember the bad doctors and the people who helped you. So my answer probably was around the answer of I just want to be that one doctor that somebody turns to and feels heard from, and I want to help shape somebody's life for the better. Oh, yeah, I'm not familiar with those two resources that you had mentioned earlier. I used just a lot of my notes and my step 1 book, which is called First Aid. It's like the Bible of studying for step 1. Step 2 is some people use it and some people don't, but for step 1, it's the go-to, at least in my time, and I think still used today. And then like pathoma and stuff was something big in medical school. And yeah, I didn't use those other 2 other resources. Oh, awesome. Well, maybe you can give me some suggestions privately of what's cool in Bloomington. And what is a mistake you made early on in your career? Again, I think it comes back to comparing yourself and trying to change your study habits to mimic what a lot of other people are doing. I had to learn along the way kind of what works best for me. Some people are really good about just listening to a lecture and absorbing it that way and not taking any notes. Some people are really good about not listening at all and just reading the slides. Some people read textbooks, and some people really do a lot of questions. And I had to start focusing on what worked for me. I think something that I did earlier in my career was kind of changing it up and trying different things constantly, instead of just listening to myself and what I was actually learning from. So don't compare yourself to others. It's endless hole. Just trust in what you're doing and that it's enough. And then if it doesn't work out that time, then it's time to adjust. But don't constantly be doing that and comparing yourself to what other people are doing. Taking the road of being a doctor's office is very stressful. Has the workload ever made you rethink your path in life while in school? Yes. As mentioned before, it takes about 15 years to get to this endpoint. There are some very, very long days. There's failures along the way, as mentioned, and the workload of studying. I literally study the way a job is. I wake up in the morning, make coffee, and start studying at like 9 a.m. and then going through the day. So the days are long. The dedication is endless. So yes, I've rethought it. I've thought about it, but really there is no plan B. There was no plan B for me. So I just stayed on track because I knew that there was no other alternative, and medical school is expensive. So you also have to think about that, and how you're gonna pay back your loans. If you were to switch your specialty, I wouldn't switch it, truthfully. If I was to switch it, I'd probably just do a subspecialty in sports medicine to add on to it. I did apply to family medicine as a backup, but people could read through my personal statement in my application because it really only talked about peds a lot, and I just kind of tweaked it a little bit to talk about family medicine, and I think there would be nothing else for me besides pediatrics. Does your undergraduate school name matter? I don't think so. There's so many undergraduate schools. I, again, think as long as you're doing your prerequisites and you have, decent grades, and by decent, I mean okay grades. I mean, it varies for so many people. I know people who had like a 2.0, I think, at one point. So I don't think it matters. It may matter if for some reason you're applying to, I don't know, Harvard, and you went to undergrad in Harvard and like they know you. But besides that, I don't think it does. What motivates you during difficult times or moments of stress during your residency? I think this just goes back to, again, what motivated me to get through medical school as well, is that in the end, your end goal is to help people and to become your own doctor eventually. So every day kind of passes, and you have to remember that this too shall pass. And the long days seem long, but trust me, residency goes by really fast. I mean, I can't even believe it's done already. So just know that you'll get through it, and then just be thankful to get the opportunity to learn from whatever difficult time or stressful time that was, and then use that to fuel you to go forward. PA or NP route versus med school. So I did not know about nurse practitioners or PAs until I got into medical school, or even, medical school or residency. Those things are just kind of up and coming in Canada. Same thing with DO schools and stuff. I don't even think there's DOs in Canada. So I did not debate that at all. I was only familiar with an MD. And to compare knowing them now, I think you have to ask yourself, are you okay with not being the final say at the end of the day? I mean, an MP can run their own clinic and do a lot of stuff, but at the end, from my understanding, it's still overseen by a doctor. I know the NPs that I worked with in the NICU have to still sign all their orders to the NICU attending. So for me, I always wanted to be the final say, and to make those big, like those last decisions. So if you are debating that, just ask yourself if that is something that you see yourself doing in the future. Yes, I think you can still have your interests such as music. I mean, it depends on how rigorous you want to practice, but as long as you prioritize, you might have to cut back on TV, or you might have to cut back on hanging out with friends for that day, but I think you can definitely do it. Again, I am a huge advocate for not giving yourself completely up to medicine. We are humans and we have other interests. So I think you can definitely stay a musician throughout medical school and residency. No, so you have to understand that medical school is expensive. And if you go out of state or if you go to a Caribbean med school or anything. So I do have bank loans and I have government loans. And that is usually typical for any given medical student. And I am still paying them off currently. Those are going to take a few years. So you start chipping away at them in residency if you can, and if not, some people postpone paying them off until they get their attending job. You've always wanted to be a pediatrician, but recently a career in science, education, instruments, and something that would help me. So again, I think you can be a major in anything you choose. Again, as long as you're doing your prerequisites, and you can do that later as well. You can add it on to your major if for some reason you can't fill it into your major of science education. Some people just take an extra year and do all the prereqs if you decide that medicine is right for you. And I think what you end up having to say if you do end up going to medicine with your science education, I mean, that still sounds very reasonable and relative to the world of medicine and where it's leading to right now, is basically, again, saying it's an asset and seeing and spinning it in some kind of way that says, this is what I can offer some insight to, and I'm sure it would actually be a huge talking point during your interviews and application. Residency for pediatrics is 3 years in the States and 4 years in Canada. That's not a weird question at all. So the question is, can you have a relationship while in medical school, and marriage and kids? So I am married. I got married in my second year of residency. I did do a long distance relationship throughout medical school. So there is that, but it's doable. It's, again, just like anything else. You need to have a good communication and determination to make it work. But I know that almost everybody that I'm in residency with have a relationship and get married, and a lot of them have kids. So again, that is something that you have to think about when you're deciding your specialty. For pediatrics and like stuff like family medicine, a lot of people are able to do that, and a lot of the mentality allows that, and is supportive about having that in your life. It's not so much in things like OB or surgery. It's still doable. I know a lot of people that are married and have kids in all of those specialties, but you have to think about the time away from your family when you're in residency. Again, you're just on call a lot more when you're doing things like surgery and OB/GYN. But yes, you can have it all in the whole spectrum of things. Okay, I think that's all of the questions. Thanks, guys. I'm gonna type in here my Instagram name if you guys want. Please feel to reach out to me anytime. I get a lot of questions about med school and residency and all of the different stuff we talked about, so we could talk one-on-one if you're interested in that. I know it was a lot of information, so.
Thank you
You're
so
very
much for
welcome.
sharing with us, Dr. Chan, and thank you everyone for joining us and hearing her message. This will be posted on our website if you want to look back at it, and that will conclude this meeting. Thank you very much for joining us.
Thanks, guys. Take care. Good luck.
Have a
Thank
great day,
you.
everyone. Thank you for joining us.